41-year-old female patient is admitted to the Rheumatology and Rehabilitation Clinic as an inpatient.
Hello, Mr. Simula. I am Pavel Glovatsky, and I will be your chief physiotherapist. Please, take a seat and prepare your documentation.
Good morning. I'm so happy about today's appointment. I really do not feel well, and it's been a long way to finally see you.
I understand. Please, tell me more about your discomfort. I hope to be able to improve your condition.
Well, I've experienced pain in my palms and foot joints for over half a year. It's quite symmetrical pain of the palm joints, and with time progressing, it's increasing.
I see. Your medical documentation shows inflammation of the upper and lower limb joints. Does the pain interfere with your daily activities?
Yes, a lot, especially in the early morning hours when my morning stiffness lasts for more than 1 hour. Then I can't perform any of my morning daily activities.
Do you have anyone to help you then?
I do. I live with my husband and 2 kids, so they take over some of my duties.
Are there any other accompanying symptoms?
I have a slightly elevated body temperature, about 37.5 degrees Celsius, and I feel constant fatigue. Over the last 2 months, I've also lost some weight, and I'm really weak now.
I can see how concerned you are. Our team will try to improve your condition. Please tell me, has anyone in your family ever experienced something similar?
Well, my mother did. She died 3 years ago and suffered from rheumatoid arthritis as well.
Okay, I would like to examine you now, Mr. Simula. Let me have a look at your hand joints. Well, luckily there is no redness of the skin, but I feel increased warming. Does this hurt?
The physiotherapist puts some pressure on the joints.
Oh, yes, it is quite painful.
I feel this area is really sore, swollen, and the hand joints are stiff. Some loss of muscular muscle mass in the thumb is also present.
You're right, my hands don't feel the same they did some months ago.
Let me have a look at your elbows. I would like to check their range of motion. Can you stretch one out and now place it at your side? This kind of movement is called abduction and adduction. Okay, and now please bend your arm. We need to check flexion and extension.
This is not easy.
I understand. And finally, I need to check rotation, outward and inward. We will have to work on this. There are significant limitations in extension.
And what about my feet? They're sore as well.
Yes, I'm going to examine them right away. Let me palpate your feet and check ROM, range of motion. Outward and inward rotation is also limited. Now, I'll see how much you can bend your feet at the ankle. Bend your right foot back and away from the body, please. Fine. Let's look at the left foot now. And then we are going to check inversion and eversion. This means that you should rotate your feet inward and outward. Very good.
It's really painful.
I'm sure it is, and I'm sorry, but it won't last long. And finally, your toes. We need to move them up and down. I have to check them in 2 planes. This is called abduction-adduction. And extension-flexion.
So this is the same kind of movement as when you were examining my elbow?
Yes, I will put it in the documentation that you experienced soreness under pressure, swelling, and stiffness of the foot joints.
Would you like to have a look at the results of my diagnostic tests?
Yes, indeed. The X-ray examination of your hand and foot joints shows osteoporosis related to the joints, narrowed gaps between the joints, and some observable erosion on the joint surfaces.
True. and these are my laboratory tests.
Aha! The laboratory tests show increased levels of CRP and ESR, and also a positive RF, rheumatoid factor. In other words, the diagnosis is confirmed you suffer from rheumatoid arthritis.
I really hope physiotherapy will bring me relief.
I'm going to present you with our comprehensive treatment plan. First, medicines. In terms of pharmacotherapy, we are going to include disease-modifying drugs, synthetic conventional pharmacological treatment, and non-steroidal anti-inflammatory drugs in the event of severe pain. Your family doctor will also be notified about these recommendations.
All right, and what about rehabilitation?
Primarily, the rehabilitation treatment applied will be electrotherapy, laser therapy, and balneotherapy.
What is the purpose of these particular methods?
Electrotherapy uses low-frequency currents to cause muscle or nerve spasms. We are going to use laser therapy treatment with a laser beam of the appropriate intensity, which, when penetrating the tissues, causes the analgesic anti-inflammatory and anti-oedema effect. It also increases blood oxygenation.
And balneotherapy?
Balneotherapy, also known as hydrotherapy, has an analgesic anti-inflammatory and muscle-relaxing effect. All in all, you should feel some relief very soon.
Well, sounds promising.
And finally, Kinesi Therapy. I'm going to present you with a number of physical exercises which will help you increase muscle strength, improve physical fitness, and prevent joint contractures and deformities.
This sounds like a lot of physical activity.
We will exercise regularly, every day, in the late morning hours. Here is a detailed patient treatment plan for you. Thank you very much for presenting me with your history and queries.
I have one more concern. Should I prepare for these exercises in any special way?
Some loose, convenient clothing would do. And please do not eat 30 minutes before our meeting. I will give you the rest of the instructions tomorrow. Okay?
Of course. Thank you so much for being patient with me and for your careful examination. I feel really secure with such care. See you tomorrow, Mr. Pavel.
Thank you too, and see you tomorrow at 11 a.m.